Welcome. This is the New England Journal of Medicine. I'm Dr. Michael Bierer. This week, June 6, 2024, we talk about neoadjuvant immunotherapy for dMMR colon cancer, TAVR in patients with a small aortic annulus, gene editing and retinal degeneration, and the genetic diagnosis of rare diseases, a review article on disorders of magnesium, a case report of a woman with metastatic breast cancer, and a perspective on malicious midwives, fruitful vines, and bearded women. Neoadjuvant immunotherapy in locally advanced mismatch repair deficient colon cancer by Miriam Chalabi from the Netherlands Cancer Institute, Amsterdam, and co-authors. Mismatch repair deficient dMMR tumors can be found in 10 to 15% of patients with non-metastatic colon cancer. In these patients, the efficacy of chemotherapy is limited. In this Phase 2 study, patients with non-metastatic, locally advanced, previously untreated dMMR colon cancer were treated with neoadjuvant immunotherapy including nivolumab plus ipilimumab. Of 115 enrolled patients, 98% underwent timely surgery. 2 patients had surgery delayed by more than 2 weeks. Grade 3 or 4 immune-related adverse events occurred in 5 patients, 4%, and none of the patients discontinued treatment because of adverse events. Among the 111 patients included in the efficacy analysis, a pathological response was observed in 98% of the patients, including 95% of patients with a major pathological response, defined as 10% or less residual viable tumor, and 68% with a pathological complete response, 0% residual viable tumor. With a median follow-up of 26 months, no patients have had recurrence of disease. In patients with locally advanced dMMR colon cancer, neoadjuvant nivolumab plus ipilimumab had an acceptable safety profile and led to a pathological response in a high proportion of patients. Andrea Sursak from Memorial Sloan Kettering Cancer Center, New York, writes in an editorial that although it is exciting to see such marked responses, these results by Chalabi and co-authors alone do not support the adoption of this approach as the standard of care for patients with early-stage dMMR colon cancer. It is important to recognize that surgical resection alone is curative in the majority of stage 2 dMMR colon cancers, and that adjuvant therapy applies predominantly to stage 3 disease. Staging of dMMR colon cancer is especially challenging, given that tumors with microsatellite instability are often associated with falsely positive enlarged lymph nodes owing to immune infiltration. Thus, a substantial proportion of patients with dMMR colon cancer would not need any treatment beyond surgical resection. Furthermore, although the incidence of grade 3 or 4 adverse events due to immune checkpoint blockade in this study was 4%, long-term, presumably permanent endocrine dysfunction developed in 11% of the patients and resulted in treatment. The risks must always be considered, especially since all the patients underwent surgical resection. We do not know whether neoadjuvant immune checkpoint blockade increased the percentage of patients with disease-free survival, which would be expected to be high with surgery alone. A well-designed randomized trial would provide important insights into the staging of this disease, the benefit of neoadjuvant or adjuvant immune checkpoint blockade in this patient population, and the appropriate treatment and duration of therapy. At the present time, we have 2 options for trials: to pursue organ preservation or to better determine which patients benefit from neoadjuvant immune checkpoint blockade and surgery. Self-expanding or balloon-expandable TAVR in patients with a small aortic annulus, by Howard Herman from the Perelman School of Medicine at the University of Pennsylvania, Philadelphia, and co-authors. Patients with severe aortic stenosis and a small aortic annulus are at risk for impaired valvular hemodynamic performance and associated adverse cardiovascular clinical outcomes after transcatheter aortic valve replacement, TAVR. In this study, 716 patients with symptomatic severe aortic stenosis and an aortic valve annulus area of 430 millimeters squared or less were randomly assigned to undergo TAVR with either a self-expanding supraannular valve or a balloon expandable valve. The Kaplan-Meier estimate for the co-primary endpoint of the percentage of patients who died, had a disabling stroke, or were rehospitalized for heart failure through 12 months, tested for non-inferiority, was 9.4% with the self-expanding valve and 10.6% with the balloon expandable valve. The Kaplan-Meier estimate for the co-primary outcome of the percentage of patients with bioprosthetic valve dysfunction through 12 months tested for superiority was 9.4% with the self-expanding valve and 41.6% with the balloon expandable valve. Moderate or severe prosthesis patient mismatch at 30 days was found in 11.2% of the patients in the self-expanding valve group and 35.3% of those in the balloon expandable valve group. Major safety endpoints appear to be similar in the two groups. Among patients with severe aortic stenosis and a small aortic annulus who underwent TAVR, a self-expanding supraannular valve was non-inferior to a balloon expandable valve with respect to clinical outcomes and was superior with respect to bioprosthetic valve dysfunction through 12 months. Gene editing for CEP290-associated retinal degeneration by Eric Pierce from Mass Ioneer, Boston, and co-authors. CEP290-associated inherited retinal degeneration causes severe early-onset vision loss due to pathogenic variants in CEP290. EDIT-101 is a CRISPR-Cas9 gene-editing complex designed to treat inherited retinal degeneration caused by a specific damaging variant in intron 26 of CEP290, IVS26 variant. In this Phase 1-2 study, 12 adults and 2 children with CEP290-associated inherited retinal degeneration caused by a homozygous or compound heterozygous IVS26 variant received a subretinal injection of EDIT-101 in the worse study eye. The primary outcome was safety, which included adverse events and dose-limiting toxic effects. No serious adverse events related to the treatment or procedure, and no dose-limiting toxic effects were recorded. 6 participants had a meaningful improvement from baseline in cone-mediated vision as assessed with the use of full-field stimulus testing, of whom 5 had improvement in at least one other key secondary outcome. 9 participants, 64%, had a meaningful improvement from baseline in the best-corrected visual acuity, the sensitivity to red light as measured with full-field stimulus testing, or the score on the mobility test. 6 participants had a meaningful improvement from baseline in the vision-related quality of life score. The safety profile and improvements in photoreceptor function after EDIT-101 treatment in this small Phase 1-2 study support further research of in vivo CRISPR-Cas9 gene editing to treat inherited retinal degenerations due to the IVS26 variant of CEP290 and other genetic causes. In an editorial, James Bainbridge from the University College London Institute of Ophthalmology writes that genetic diseases of the retina cause sight impairment affecting millions of children and adults worldwide. Until relatively recently, management has been wholly limited to supportive measures. During recent decades, however, rapid advances in molecular biology and microsurgery have revealed key disease mechanisms and enabled the development of novel, targeted interventions. The most compelling successes to date have involved gene supplementation approaches in which a genetic deficiency is compensated by the sustained local expression of the deficient protein. This outcome is achieved with the use of a DNA vector as a means to usher complementary DNA encoding the therapeutic replacement gene into surviving cells. However, a gene supplementation approach is not feasible for CEP290-associated retinal disease because the size of the CEP290 gene exceeds the capacity of current vector systems. The development of Cas9 gRNA gene editing, however, offers the possibility of sustained benefit after a single intervention to delete the pathogenic gene variant itself. The results of the study by Pierce showed that the greatest benefit of EDIT 101 was in younger participants with severe sight impairment before the intervention, and that treatment early in the course of the disease is likely to be most effective. Recruitment to the study was suspended prematurely. Had more children been included, a more consistent effect on visual acuity may have been observed. The questions of long-term safety, scalability, and accessibility must also be addressed. This major achievement provides hope for people affected by CEP290-associated sight impairment and other genetic eye diseases. Genome Sequencing for Diagnosing Rare Diseases by Monica Wojcik from Boston Children's Hospital and co-authors. Genetic variants that cause rare disorders may remain elusive even after expansive testing, such as exome sequencing. This study gauged the diagnostic yield of genome sequencing after negative results from exome sequencing and other methods. The investigators sequenced the genomes of 822 families, 744 in an initial cohort and 78 in a replication cohort, and made a molecular diagnosis in 218 of 744 families, 29.3%. Of the 218 families, 61, 28%, 8.2% of families in the initial cohort, had variants that required genome sequencing for identification, including coding variants, intronic variants, small structured variants, copy-neutral inversions, complex rearrangements, and tandem repeat expansions. Most families in which a molecular diagnosis was made after previous non-diagnostic exome sequencing, 63.5%, had variants that could be detected by reanalysis of the exome sequence data, 53.4%, or by additional analytic methods, such as copy number variant calling, to exome sequence data, 10.8%. The investigators obtained similar results in the replication cohort, in 33% of the families in which a molecular diagnosis was made, or 8% of the cohort. Genome sequencing was required, which showed the applicability of these findings to both research and clinical environments. The diagnostic yield of genome sequencing in a large, diverse research cohort and in a small clinical cohort of persons who had previously undergone genetic testing was approximately 8% and included several types of pathogenic variation that had not previously been detected by means of exome sequencing or other techniques. Magnesium Disorders, a review article by Rian Howes from McGill University, Montreal. Although the past several years have seen substantial advances in the understanding of molecular and cellular mechanisms regulating sodium, potassium, calcium, bicarbonate, and volume homeostasis in health and disease, there has been a paucity of clinically relevant information about disorders of magnesium. Reasons for the apparent lack of appreciation for the clinical significance of magnesium may be due, at least in part, to the lack of information regarding the regulatory processes of this cation at the cellular, tissue, and systems level. The normal serum magnesium concentration in adults is 1.7 to 2.4 milligrams per deciliter and is tightly controlled through intestinal absorption, renal excretion, and storage in bone. Hypomagnesemia is present in 3 to 10% of the general population, but its prevalence is increased among persons with type 2 diabetes and hospitalized patients, especially those in the intensive care unit. Hypomagnesemia is usually associated with other electrolyte derangements, including hypocalcemia, hypokalemia, and metabolic alkalosis, and refractory hypokalemia is often responsive to treatment only after the magnesium concentration has been normalized. Patients with hypomagnesemia often present with nonspecific symptoms such as lethargy, muscle cramps, or muscle weakness, and thus the diagnosis of magnesium deficiency may be overlooked. Many drug classes, such as antibiotics, diuretics, biologic agents, immunosuppressants, proton pump inhibitors, and chemotherapies, cause renal magnesium loss and hypomagnesemia. In 80% of patients with familial hypomagnesemia, pathogenic variants in genes that encode for magnesium transport pathways have been identified. A 45-year-old woman with metastatic breast cancer, a case record of the Massachusetts General Hospital by Nalima Vidula and co-authors. A 45-year-old woman was evaluated in the oncology clinic of the hospital because of metastatic triple-negative breast cancer that had progressed despite chemotherapy. 6 years earlier, the patient noticed a mass in the right breast. A core needle biopsy was performed, and pathological examination of the specimen revealed invasive ductal carcinoma with no lymphovascular invasion. Lumpectomy of the right breast, along with sentinel node biopsy of the right axilla, was performed. Pathological examination of the specimen that was obtained by means of lumpectomy confirmed the diagnosis of invasive ductal carcinoma. The patient's tumor was grade 3, negative for estrogen receptor, weakly positive for progesterone receptor, and negative for HER2, findings consistent with a diagnosis of triple-negative breast cancer. The patient received adjuvant chemotherapy followed by radiation therapy. During the subsequent 3.5 years, surveillance imaging showed no evidence of disease recurrence. 18 months before the current presentation, the patient began to have episodes of left arm weakness and numbness, which occurred 1 or 2 times per week. MRI of the head revealed a partially cystic mass in the right precentral gyrus. The patient underwent resection of the brain metastasis, followed by radiation to the brain and chemotherapy with capecitabine. Progressive brain metastases and enlargement of the perihilar nodes developed several months later. Stereotactic radiosurgery to the brain metastases was performed, and treatment with a different line of chemotherapy was started. However, several months later, progressive brain metastases developed, and the size of the right perihilar nodes further increased, which resulted in compression of the right superior pulmonary vein. This case discusses the management of this patient's triple-negative breast cancer with metastasis to the lung and brain. Malicious midwives, fruitful vines, and bearded women. Sex, Gender, and Medical Expertise in the Journal. A perspective by Ben Maldonado and co-authors from Harvard University, Cambridge, Massachusetts. Since its founding in 1812, the journal has served as a source of medical claims about sex differences, portraying male and female bodies as not only different in terms of physiology, but completely different in nature. Sex was, as one 1844 article put it, quote, "the greatest distinction by far of any which exists among mankind," end quote. Early articles in the journal openly endorsed the superiority of men over women. An 1892 summary of a speech by Scottish physician James Crichton Browne, for example, argued that differences in brain sizes and thus intelligence were a fundamental sexual distinction between men and women. These authors analyzed publications in the journal's archives covering more than 200 years. The sources they present in this perspective are both extraordinary and representative of the journal's approach to sex in medicine. Can women practice medicine? Closely associated with the founding of Harvard Medical School, the journal has served as an outlet for debate regarding who can participate in medical education and practice. During the journal's first century, ideas about innate differences between men and women, elaborated using medical and physiological language, flourished as a justification for the exclusion of women from the medical profession. Over the course of the 20th century, women's participation in medicine was transformed, a development that was debated and discussed extensively in the journal. Reproductive biology and medicine. From the earliest days of the journal, articles emphasized that female bodies were biologically distinct from male bodies because of their reproductive capacity, a difference that frequently marked women as intellectually and physically inferior to men. Diagnosing sex and maintaining the sex binary. Discourse about sex and gender in the journal has not been restricted to immense interest in female diseases and organs, but has also included a steady literature on what might broadly be referred to as intersex conditions. For more than 2 centuries, the journal has circulated ideas about innate sex differences in the authoritative language of medicine and science that played a role in facilitating the exclusion of women from medical practice, the essentialization of women patients to their reproductive roles, the medical surveillance of gender norms, and the mistreatment of intersex people. Much work remains to be done. In our images in clinical medicine, a 3-year-old boy had intermittent abdominal pain, nausea, and vomiting. Ultrasonography of the right lower abdomen showed a target sign lesion measuring 1.7 centimeters by 1.4 centimeters. A longitudinal view of the same lesion showed a 2.4 centimeter segment of the small intestine telescoping into itself, a finding known as the sleeve sign. A diagnosis of ilio-ileal intussusception was made. Intussusception is the most common cause of bowel obstruction in children. In most cases, small bowel intussusception reduces spontaneously. In this case, the patient's symptoms and abnormal findings on ultrasonography abated 30 minutes after the initial ultrasound examination. The patient was monitored in the hospital for 1 day. He had no recurrence of abdominal pain and was discharged. In another image, a 57-year-old woman presented with a 3-hour history of abdominal pain and vomiting. A point-of-care abdominal ultrasound of the epigastric region showed a finding known as a target sign. When the mass was viewed longitudinally, active peristalsis of a segment of jejunum inside a sheath of free fluid and an outer layer of jejunum could be seen. See the videos at NEJM.org. A diagnosis of small bowel intussusception was made and was confirmed on CT. Intussusception is an uncommon cause of bowel obstruction in adults. The majority of cases are associated with a pathologic lead point. Laparotomy was performed, during which the intussusception was reduced. A mass was identified as the lead point and was resected along with 10 centimeters of jejunum. Histopathological analysis identified the mass as a benign fibroblastic polyp. The patient was discharged on postoperative day 8 after an uncomplicated recovery. This concludes our summary. Let us know what you think about our podcast. Any comments or suggestions may be sent to audio@nejm.org. Thank you for listening.